think of the student as someone that's going to be an individual that needs part of your life poured into their life.
I really enjoy and look forward to those Tuesday afternoons and going into a doctor's office and being able to follow them, being able to learn, being able to do things.
I've been involved with the Preceptorship since its inception. And every year it gets better.
Welcome to the Preceptorship program. My name is Rachel Bramson. You are joining a long tradition of outstanding clinical teaching at the Texas A&M University System Health Science Center College of Medicine. In 1977, the College of Medicine joined forces with Scott & White Clinic and Hospital to educate physicians for the state of Texas. In 1979, Dr. O.C. Cooper founded the Preceptorship program. Texas A&M was one of the first schools in the country to offer clinical teaching early in the medical curriculum. In 1999, the Texas A&M University System Health Science Center was formed. This includes the Baylor College of Dentistry in Dallas and the Institute of Biosciences and Technology in Houston. The College of Medicine, the School of Rural Public Health, and the Graduate School of Biomedical Sciences in College Station are also a part of the Health Science Center. Today, the Preceptorship program stays on the cutting edge thanks to preceptors like you. You give our students early, hands-on experience working as clinicians under supervision in your office. You and your preceptor colleagues in the community are crucial to our success in training top-quality physicians. Here at the College of Medicine, we are committed to helping you be the best teacher and role model possible. The goal of the Preceptorship program is to give the medical students clinical experience working directly with patients. Most of the course focuses on primary care with electives and subspecialty fields. This allows these future physicians to interact with a wide range of patients and develop professional skills that are critical to their future success. Today, we'll look at several aspects of the Preceptorship program. First, we'll describe how the Preceptorship program works and how it fits into the general medical curriculum. Next, we'll focus on how to give the medical students hands-on training in a clinical environment. Finally, we'll also look at how to give the students constructive feedback. If you know about vacation time or CME time out of the office in advance, please contact our office so we can make other arrangements for the student. If you have a colleague that can work with the student, we welcome that opportunity. However, we are also happy to place the student with someone else. To support you in your role as a clinical teacher, we offer a variety of programs. These include free CME and instruction on medical topics, information search skills, and teaching skills. You'll be notified throughout the year of these opportunities. Feel free to contact our office for more information if you have specific interests or needs. As a preceptor, you might want to know more about the structure of the program and how it fits into the medical school curriculum. This is a required year-long course which is focused on ambulatory care. It's community-based and meets on Tuesday afternoons throughout the year. There are about 25 Tuesday afternoons, which involve 3 long block rotations. Each block has 5 sessions. We like to allow the physician and student to meet together 5 times. This creates continuity and permits a more detailed assessment of the student's progress and knowledge base. It also gives the physician a chance to learn to trust the student and know what their strengths and weaknesses are. This lets the student do more in the office than they can in a single individual encounter. We also expect each student to do a thorough history and physical during each of the long block rotations. They have been trained already in communication skills and medical examination skills, but they need a chance to practice in a real-life setting. Who teaches these 5-session rotations? We have a combination of family physicians, internists, and some subspecialty physicians who participate in the continuity blocks. The students really look forward to these sessions because it's the first time they can apply the knowledge they've learned in courses at the College of Medicine to real-life patient care. They also enjoy the elective block, which consists of 5 single afternoon sessions. These are designed to give a student a brief exposure to a field, such as ophthalmology, radiology, or cardiology. This way, the students can sample a future career choice and also hone the skills that are particular to that discipline. In addition, each student spends 2 afternoons with a pediatrician and participates in an Introduction to Surgical Skills course. This requires several sessions on sterile procedures, basic suturing, and an operating room experience. How have students been prepared to work with you in your office? During the first year, they learn to take a history and do a physical exam. In the spring, when they learn the physical exam, they also learn to do a breast exam and get to practice on a standardized model patient. Before they come to your office in the second year, each student will have participated in a series of workshops on specialized or more difficult exams. These include the pap and pelvic, the male genital exam, and how to do a brief hallway presentation of a patient case. They have received a good introduction to these skills, but they still need practice. That's where you come in. The students know how to do a complete history and physical. If you are comfortable, we urge you to let the student work independently at first, and then report back to you. We find that this results in a greater level of learning on the part of the student, and forces them to commit to an assessment and plan. Of course, you'll need to chaperone them if they are doing breast, pelvic, rectal, or male genital exams. I think you'll be surprised at the level of skill that our students have achieved so early in their curriculum.
One of the things that I've noticed in going through the students' evaluations of the course is the preceptors who always rank the highest with the students are the preceptors that let the students do the most.
Most of the doctors that I was with allowed me to go in and do a history and physical prior to going in together and seeing the patient, so I got a lot of practice doing that.
The second year curriculum is based on organ system blocks. That means that for 2 weeks they may be studying the renal system, for 2 weeks they may be studying the cardiovascular system. This will include the pathology, physiology, pharmacology, and microbiology for each organ system. If you have the opportunity, we encourage you to highlight the systems that they are studying at the time. The students are so excited about applying their book learning to real-life situations.
Being able to see some of the things that we've been learning about in the books, some of the pathology and some of the pharmacology that we've been learning about and reading about, in theory, comes to life when we see it with the patient.
When you take a young person into their first delivery, as I've done in the last couple of weeks, another M2 into the first delivery, the first C-section, the first this, the first that, and the excitement in their eyes, the fulfillment of all this education, all this struggle, and it's finally coming to fruition.